Good morning, class. My name is WealthyNurses. Today we will have a review of Chapter 1 Healthcare Delivery and Nursing Practice. If you are ready, let's begin. Question 1. The school nurse teaching a health promotion class to high school students informs the group that health may be defined as A. Being disease-free. B. Having fulfilling relationships. C. Having a clean drinking source and nutritious food. D. Being connected in body, mind, and spirit. You have 30 seconds to answer starting now. That is right. The answer is D. Being connected in body, mind, and spirit. Question 2. Which of the following desirable characteristics would an effective nurse possess? A. Sensitivity to cultural differences. B. Team-focused nursing approach. C. Strict adherence to routine. D. One set of cultural practice. You have 30 seconds to answer starting now. That is right. The answer is A. Sensitivity to cultural differences. Question 3. What type of health problem is the nurse most likely to see in the healthcare system? A. Poor prenatal care. B. Lack of information. C. Immobility. D. Chronic disease. You have 30 seconds to answer starting now. That is right. The answer is D. Chronic disease. Question 4. The nurse is assisting a patient who is planning to return to work after an extensive illness. The patient's need for self-fulfillment fits in which level of Maslow's hierarchy of basic needs? A. Physiologic. B. Safety and security. C. Love and belonging. D. Self-actualization. You have 30 seconds to answer starting now. That is right. The answer is D. Self-actualization. Question 5. Viewing health and illness on a continuum assists the nurse in understanding that A. Care should focus on the treatment of disease. B. A person's state of health is ever-changing. C. A person does not have varying degrees of illness. D. Care should focus on the patient's response to medications. You have 30 seconds to answer starting now. That is right. The answer is B. A person's state of health is ever-changing. Question 6. The nurse working in a community health clinic teaches that disease prevention is best achieved through A. Attending self-help groups. B. Yearly physicals. C. Community social events. D. Behaviors that promote health. You have 30 seconds to answer starting now. That is right. The answer is D. Behaviors that promote health. Question 7. A nurse on a medical surgical unit has been asked to become a member of the hospital's continuous quality improvement CQI, Committee. In preparing to serve on this committee, the nurse learns that CQI programs A. Establish accountability on the part of healthcare professionals. B. Focus on the process used to provide care. C. Identify incidents rather than processes. D. Justify healthcare costs. You have 30 seconds to answer starting now. That is right. The answer is B. Focus on the process used to provide care. Question 8. Managed healthcare has led to significant changes in the healthcare delivery system. What effect has managed healthcare had on the hospital's patient population? A. Patients are in the hospital for a longer period of time. B. Pre-negotiated payment rates have remained unchanged. C. Patients with high home care needs are being discharged into the community. D. Use of ambulatory care has decreased. You have 30 seconds to answer starting now. That is right. The answer is C. Patients with high home care needs are being discharged into the community. Alright guys, my partner Nurse Rowena will continue the remaining half of the question. She works at Rush Medical Center in Chicago, one of the best hospitals in the world. Please give her a warm welcome.
Hello. My name is Rowena. I have been a nurse for more than 20 years now. Currently, I work at Rush Medical Center. I am so excited to help you today. Without further ado, let's continue the review of the test. Question 9. The patient's Bill of Rights includes the patient's right to privacy. When might the nurse break this right? A. When the patient has threatened to harm himself or herself. B. When the patient has been diagnosed with a terminal disease. C. If a family member has called to inquire about the patient's condition. D. There are no circumstances when this rule may be broken. You have 30 seconds to answer starting now. That is right. The answer is A. When the patient has threatened to harm himself or herself. Moving on to the next question. Question 10. In order for the nurse to implement the interventions in a clinical pathway, what first must be done? A. Interventions must have a signed physician's order. B. The nurse manager must review the plan. C. The unit must approve the document. D. The nurse must sign the document prior to initiating. You have 30 seconds to answer starting now. That is right. The answer is A. Interventions must have a signed physician's order. Moving on to the next question. Question 11. A nurse researcher is conducting a study about the effects of noise on hospitalized patients' pain levels. The primary purpose of nursing research is to A. Involve patients in their care while hospitalized. B. Contribute to the scientific base of nursing practice. C. Draw conclusions about the quality of patient care. D. Explain ongoing medical studies to patients. You have 30 seconds to answer starting now. That is right. The answer is B. Contribute to the scientific base of nursing practice. Moving on to the next question. Question 12. Home health care is becoming one of the largest practice areas for nurses. What has contributed to this change? A. Chronic nursing shortage. B. Focus on treatment of disease. C. Nurses prefer working during the day instead of evening or night shifts. D. More critically ill patients being discharged to home from the hospital. You have 30 seconds to answer starting now. That is right. The answer is D. More critically ill patients being discharged to home from the hospital. Moving on to the next question. Question 13. A nurse is practicing in an oncology clinic and her role includes clinical practice, education, management, consultation, and research. Which of the following would most accurately describe this nurse's title? A. Midwife. B. Clinical nurse specialist. C. Nurse manager. D. Staff nurse. You have 30 seconds to answer starting now. That is right. The answer is B. Clinical nurse specialist. Moving on to the next question. Question 14. Nursing continues to recognize the importance of collaboration with other health care disciplines to meet the complex needs of the patient. Which of the following would be an example of a collaborative practice model? Option A. The nurse and the physician discussing and jointly making clinical decisions. B. The nurse accompanying the physician on rounds. C. The nurse making a referral on behalf of the patient. D. The nurse attending an appointment with the patient. You have 30 seconds to answer starting now. That is right. The answer is option A. The nurse and the physician discussing and jointly making clinical decisions. Moving on to the next question. Question 15. According to Maslow's hierarchy of needs, which dimension of care is considered primary in importance when caring for a dying patient? A. Spiritual. B. Social. C. Physiologic. D. Emotional. You have 30 seconds to answer starting now. That is right. The answer is C. Physiologic. Moving on to the final question. Last question 16. When prioritizing a patient's care plan based on Maslow's hierarchy of needs, the nurse's first priority would be A. Allowing the family to see a newly admitted patient. B. Ambulating the patient in the hallway. C. Administering pain medication. D. Teaching the patient to self-administer insulin. You have 30 seconds to answer starting now. That is right. The answer is C. Administering pain medication. Great job! If you like this video, please consider subscribing and hit the notification bell. Feel free to comment and share with your friends. Thank you. Oh, just to remind you guys, don't forget to get your own copy of these books for your reference and further reading. Brunner and Suddarth's Textbook of Medical Surgical Nursing 14th edition. Including the study guide for Brunner and Suddarth's Textbook of Medical Surgical Nursing 14th edition. You may also need the clinical handbook for Brunner and Suddarth's Textbook of Medical Surgical Nursing 14th edition. For your convenience, I included the link in the description of this video. Check them out.